I'm Charmaine Charlie Brown, and this is my husband, Ted. I am 65 years young. When I was in my 30s, I had to have a hysterectomy because of fibroids. They were very significant in size, and it caused me a lot of bleeding and discomfort. So the only option was at that time was to do a hysterectomy, and in doing so, it kind of forced me into early menopause. At that time, I was in my 30s, and my doctor opted to give me estrotest, which is a synthetic hormone replacement, and did okay with that. But as the years went on, they decided to take me off of it abruptly. There was no other recommendation, just took me off of it cold turkey. And so I'd been on the hormone replacement therapy for many, many years. And so being without it, I was totally depleted of any hormones at all being secreted at all. They did leave me with my ovaries, but eventually I had to have those removed because of fibroid tumors. So it sent me in a downward spiral. I noticed that I was very tired, sluggish. I didn't have very much energy, and I'm very energetic. And so losing that ability or that desire to want to exercise was bad for me. But more importantly, I'd lost my libido. My husband and I have been married for over 47 years, and we are very sexually active. I love being attracted to my husband. I love the fact that he thinks I'm desirable, but I didn't feel it. My skin was dry, my hair was dry. I didn't have the ability to think quick. I think I am very quick-witted, but I didn't have that snappy comeback. My thought process was very slow. I couldn't retain information, and that was devastating for me, in that I am an RN. I'm a registered nurse, I'm a provider. So not to be able to recall certain names or procedures and things like that, and I couldn't dare tell anyone because you didn't want to admit it, for one. And so at some point, I was at church. Fast forward, I was at church, and it was during the winter months, and I was sweating profusely. And so some of my sisters in Christ was noticing me. One removed my jacket, and the other one helped me take off, my shoes, thinking if my feet were exposed to the air, I'd cool off. And I was horribly embarrassed because sweat is just pouring off of me. And it was just something I went through all the time. I had hot flashes, night sweats, like I said, foggy memory. I had no sexual desires. I felt hollow on the inside. And that's important to me. I can't speak for anyone else, but I can speak for me. And so, honey, did you want to add anything to that?
Yes. Help is what you need in order to get through this.
Yeah.
Because I wasn't really sure on how we were going to get through this. So,
he was
prayer is okay,
yeah,
but
right.
help is very much needed. So,
yay, God.
I'm most appreciative of the help that we've had,
Yeah.
and it's working out real well. I
I
don't
should
have
say,
any downside now.
Yeah.
It's good.
Yeah.
So-
We're very appreciative of Dr. Stanley. Back to the ladies that helped me undress when I'm had those epic moments that were literally changing my life, not for the best. And so one of them told me there is no need for me to suffer. And I don't know, it's something about medication and Christianity. It's just like the two should not meet. But me being a medical provider, I know the importance of medication, and when it's used appropriately, it can really aid in the healing process. And so when I talked with Dr. Stanley about what I was going through, I literally cried after I left her office, because there was help available to me, and not just to me, but for me and for my husband. He benefits from it. So she ran a series of battery of tests to make sure that she was giving me exactly what my body needed for me to function as a whole person. And so based on what my lab results reflected, that was the medication that she compounded for me. So it was like a designer prescription for me. And I promise you, my hair is growing back. My skin is dewy again. My thinking, I'm sharp with my thinking. I can retain information. I feel I feel like a woman again. I feel like a female, and I feel feminine. And I know what it's like not to have those hormones. And so now that I have them, and I have them in the areas that I need the most, I can't be happier. So if you're suffering any of these symptoms, there's help available. Like my husband said it best, there's help available.
Thank